Good morning, and thanks for joining us on your way into work or from work, wherever you are at this point. We are live from Gunderson Health System for the Children's Miracle Network Hospital's Radiothon. Over the next couple of days, you will hear from doctors and supporters and families who have been impacted and who help through the Children's Miracle Network Hospital's organization. We want to say special thanks, though, because it takes a lot of volunteers and it takes a lot of sponsors to put this on. So thank you to Stanek Electric and Mark Jewelers, Cooley Region Mobility, Team Marine Services, and also Ultra Federal Credit Union. And today is all about learning and also giving. Any amount would be greatly appreciated, and you can do this in many different ways. You can call 1-800-853-6889. Again, that's 1-800-853-6889. We have a bunch of volunteers at the phones just waiting to take those calls and chat with you this morning. You can also go to aroundrivercity.com to make your donation, and that's where you can also watch the live stream of this radiothon as well, so you can actually see the interviews as they are happening and see some of the families. And you can also text your donation, CMN Kids, to 51555. Again, CMN Kids to 51555. So this morning, I am joined by Dr. Erin Gutowski and Allie Allman-Dixon. They are allies for the LGBTQIA plus community. Good morning, ladies.
Good morning.
Okay,
Thank you so much for having us.
If you could first, those are a lot of letters. Okay. If you could first maybe go into a little bit about what all of those letters stand for.
Sure, absolutely. So the LGBTQ plus community, as we call it, is actually 200 different and unique identities, and even over that.
Sure.
So it includes a lot of different individuals who identify as either a gender or sexual minority. And that can be a full spectrum. So when we talk about LGBTQ plus, what we're saying is lesbian, gay, bisexual, transgender, intersex, and asexual.
Okay.
Plus a whole bunch of other identities that are part of that same spectrum, either gender or sexual spectrum.
Sure. Okay. And so what is it exactly that you guys do to support the patients here within that community?
Sure. So I'm a general pediatrician, and so I see patients from newborn up to the age of 21, 22 years of age. And I do have a special interest in LGBTQ plus health, as well as adolescent medicine and care, and mental health services. And so I work with Dr. Allman-Dixon all the time because we work together as a team in the clinic. And we provide care for our LGBTQ plus patients that's just very inclusive and gender affirming.
Okay. And that was actually going to be my question. So generally, are the patients or the parents, I mean, is it, who's of that community generally that you see? Is it kind of all?
It could be anybody, but
Okay.
generally speaking, in our clinics, it's a patient or one of the children that's identified as part of the community. And then our role is really to support and affirm them in any ways that we can.
Okay.
We're really fortunate that we have some dedicated time where we have joint visits where Dr. Gutowski and I meet with families together to talk about resources and supports for patients in the community, as well as how can we help make their medical and social transitioning the most affirming care that it can possibly be.
Okay. And so through the Children's Miracle Network Hospitals organization, where does that come in with what you guys do?
Yeah, so because of Children's Miracle Network, we actually are able to do quite a lot for our patients, which is
Awesome.
really incredible. One of the things that has made a huge difference for our families is actually having written resources for them, so books that we hand out for our first visit that talk specifically about LGBTQ plus health for young people.
Sure.
And also to give them a workbook for their gender so that they can start to think about how they see their gender and how they can start to explore that and identify. So those are two different books that Children's Miracle Network has been able to provide every single one of our gender patients, which is really
That's
incredible.
amazing.
And then we also have filled out several CMN grants for our patients to help with different medical equipment that they might need to help support them in their gender affirmation process.
Okay.
So that's been very, very exciting. And I think it's important for families to know that that exists and that we can help with those things, but they can also fill out an application online too. So that's been, I think, incredible to see how important that is for our kiddos.
Sure.
because I mean, it's just little things that they need, that they might require, but they make a huge difference.
Sure. Dr. Allman-Dixon, do you have anything to add to
Yeah,
that?
I would just add that I think that whenever we think about giving to Children's Miracle Network, and specifically the things that we're asking for in Gender Clinic from our patients, one of the things that they often talk about is making their wish list. So what is it that they need in order to feel hopeful, to feel affirmed in their gender? And those things, unfortunately, are often quite expensive and just not financially viable for many of our families.
Sure.
And so having this and having the opportunity, I think not only gives them the medical equipment they need, but also gives them hope. And as a psychologist, that's an important thing.
Yeah.
We know that patients in this community, from kids all the way to up to adult, are at risk for some pretty significant mental health concerns. And a lot of that has to do with not being able to get the supports that they need. And so one of the things that we can do is be able to offer this. And I think that's offering not just equipment, but hope.
If you are just joining us, we are live from Gunderson Health System for the Children's Miracle Network Hospital's Radiothon, and talking with area professionals and families to make sure that you understand exactly what the Children's Miracle Network Hospitals organization does for children and families right here in our community. And when you make a gift of a donation, that money is going to stay local, helping those families right here. And you can do that in a couple of different ways. You can call 1-800-853-6889. Again, 1-800-853-6889. We got all of our volunteers back there waiting for your calls. You can also text CMN Kids to 51555. Again, CMN Kids to 51555, or you can go to aroundrivercity.com. Now, this morning I'm talking with Dr. Erin Gutowski and Allie Allman-Dixon. They are allies for the LGBTQIA plus community. Now, I would imagine that this is so great that we're talking about this, because I didn't even know that this program existed. And I think that's why we're highlighting it, right?
Yeah, I think, over the last few years, we've really been able to create more of a robust program here at Gunderson so that our patients don't have to travel to larger cities to get care. A lot of our patients were traveling to Rochester or to Madison to be able to seek care for just gender affirming LGBTQ plus health. And I think that we have so much to offer right here locally. So it's been so great to be able to do that for our patients and families.
Well, not only are you helping that child who may or may not know or understand what's going on, right? And then their parents who also might be having a difficult time or just don't understand, or, I would imagine you see that a lot too.
Yeah, I would say that we've been really fortunate that most of our families have been extraordinarily supportive
great.
Of their kids. But there is a piece of this where there's a lot of learning to be done and a lot of unlearning,
Sure.
right? And so a lot of times how parents were introduced to gender or sexual orientation is very different to how their kids are learning about those things.
Sure.
And so I think that that's one of the big pieces that we're able to provide in like the bibliotherapy of the books that Dr. Gutowski was talking about. There's a lot of resources and supports in there for families as well. And we've been extremely supported and fortunate to work in a community that's been really supportive. And so we've been able to partner with other organizations, including like the local library and Seven Rivers, to help get supports for our patients and families and resources. And then we get to be a point to be able to share them.
Okay. And this might be a silly question, I don't know, but how does this conversation usually happen? Like the family comes here and then they learn about the program after. Do some of them know about it? I mean, how does that conversation usually start?
Yes, it's kind of a good mixture, actually. We have some patients who have heard through word of mouth that, like, oh, there's a pediatric gender clinic, awesome, and then they come and they see us. And some of our patients are being referred from other providers, either in the community, like within Gunderson, or from Mayo as well. So it's been really great to be able to meet all sorts of families from all different walks of life. We have patients as young as the age of 3 and 4 who are coming to us saying, yes, I'm part of the community. And then, we know from just research that patients as old as their 90s are coming out, right?
Yeah, you bet.
And so I think it's really fantastic to be able to have this network. It's not only myself and Dr. Allman-Dixon, but we actually have a team of providers here who see patients throughout the lifespan. So it's been really incredible to help families find those resources early and then stick with Gunderson to continue on through this process.
And what is the best way for somebody to reach out for that support? How do we, connect with you on that?
Yeah, absolutely. I mean, I think one of the best ways to think about getting involved in Gender Clinic or reach out would be to call pediatrics.
Okay.
You could certainly talk to your primary care provider, or any provider would be a great resource, but also calling General Pediatrics in La Crosse would be an excellent opportunity, and we can absolutely give that number too.
And the Children's Miracle Network Hospitals organization, as you mentioned, is really big in, funding all of these programs, yours included, that can help right here locally. And that's what today and tomorrow is really all about with this radiothon. We're going to be here till 6 o'clock today and again tomorrow from 6 a.m. until 6 p.m. and encouraging you to give whatever amount that is to you. It is amazing, and we will accept it and be grateful. You can call 1-800-853-6889. Again, 1-800-853-6889. You can also text CMN Kids to 51555. CMN Kids to 51555, or go to aroundrivercity.com. Special thanks to Gunderson Health System for housing us here and for all that they do in our community, the volunteers and everybody that helped to make this possible. Our sponsors, Stanek Electric, Mark Jewelers, Cooley Region Mobility, Team Marine Services, and Ultra Federal Credit Union. And we will be back live in just a little bit from Gunderson Health System for the Children's Miracle Network Hospitals Radiothon. I'm Brittany Stiles for Midwest Family Lacrosse.